Good afternoon to all. I will be presenting a study of measurement of abnormal head posture with smartphone application compared with standard method of measurement using cervical range of motion device. Abnormal head posture is a frequent and important sign of multidisciplinary importance. Ocular, vestibular, musculoskeletal abnormalities can present with AHP, particularly important in childhood when abnormalities of different origin can manifest with AHP as main clinical symptom. The differential diagnosis is broad and quantitative assessment of abnormal head posture is important for both treatment and evaluation of disease. Ocular origin abnormal head posture is a motor adaptation to avoid diplopia, to avoid confusion and to improve the quality and quantity of vision. Multiple methods have been explained to measure AHP, like traditionally goniometer, cervical range of motion, others like inclinometer, Cambridge face tracker, photographic method, Zebri's motion analysis system, three mirror method. In our study, aim of the study is to report a method of abnormal head posture measurement using smartphone application and compare it with existing standard method of abnormal head posture measurement, that is cervical range of motion device. Secondary aim is to study the various etiologies of patient presenting with AHP to pediatric ophthalmology and strabismology OPD at tertiary care center. It is a comparative observational study carried at tertiary care center. 50 patients in the age group of 8 to 60 years with abnormal head posture due to ocular conditions were included after informed consent. Along with detailed ocular examination, patient underwent head posture measurement twice, once with chrome and once with smartphone application by different examiners who were blinded to each other's measurement. Measurements obtained with both methods were compared. The methods, while measuring with chrome, the patients were asked to sit upright in the chair. The magnetic brace was placed over the shoulder, arrow pointing in north direction. Headband with 3 inclinometer was placed over the head. The inclinometer on the forehead measures the tilt, while near the left ear measures the chin up or down, while on the top measures the face turn. Patients were asked to read the Snellen's optotype as 6 meters. Even though it interrupts with distance fixation of patient, reading can be quickly taken before the head posture is altered. During measurement, patient was asked to sit upright in the chair and to read the target optotypes. As soon as patient assumed AHP, smartphone was held up to take the reading quickly. For face turn measurement, protractor app was used. It is also camera as well as level based Android application. Face turn was estimated by standing and placing the phone above the patient's head parallel to the floor. Care was taken that the nose should be could be visualized in the image. After aligning center point of protractor with the reference point, that is bregma, the plumb lines, these are sensitivity level sensitivity lines. They were aligned along 180 and 90 degree marking on the protractor, ensuring device is in the same horizontal plane and not tilted or rotated. Now one marker line was aligned along the 90 degree. This is the reference point. This is a marker line. One line is aligned along the 90 degree, another is aligned along the naso-occipital line, and this angle which we can see here 22 degree, that angle gives us the measurement of face turn. For chin elevation or depression, it is again measured with protractor app by standing on the side of the face and keeping the smartphone device perpendicular to the floor and parallel to sagittal plane, guided by plumb lines. After aligning the center of protractor with reference point, that is external auditory meatus here, the green plumb line was aligned horizontally along 180 marking on protractor, while purple line was aligned with 90 degree marking on protractor. Now one of the marking line was aligned with 180 degree marking, while other marking line was aligned along the orbitomeatal line, that is line between the tragus and external canthus. Now this reading angle between these two lines gave us one reading. The reading was repeated again after correcting the head posture. The difference between these two gave us the chin elevation or depression. Here we can see in first picture, it is with the AHP, the angle is 9.3 degree, while after correcting the AHP, the angle is 27.5 degree. So difference between two gave us the chin depression. The results of the study was analyzed by pair test or Wilcoxon sign rank test to find out the significant difference in abnormal head posture measurement between chrome and application. The p-value is less than 0.05 considered as statistically significant. Out of 50 patients in the age group of 8 to 16 years, the 70% had some form of concomitant strabismus, 24% had nystagmus, 6% had ptosis. This table number 2 shows the type of AHP with their mean variation between measurement obtained using Android app and Chrome. The face turn had a 1.7 degree of variation between the two methods. Head tilt had 1.5 degree of variation between two method. Chin elevation has 1.25 degree of variation between two method. We had only one patient of chin depression. The measurements were equal for both the patient. While as we can see in combination of head.
You have to conclude, please.
Okay. Sorry, sir. In combination of head posture, the variation was more. So we can see the comparable measurement have been obtained in case
you
of.
You want the next author here, speaker here, please. Yeah, please come.
Next should be ready.
No, next should be ready with the other podium. The next should be ready. We have two podiums simultaneous. I mean, yeah, that's all. Thank you.